by touching any point over the screen in augmented reality during registration, by touching the tip pointer of the case iPhone probe tool over the surgical bed, and by touching the screen each time a green sphere appears in augmented reality. The surgeon selects sequentially 3 different points, P1, P2, P3, over the surgical bed in the same plane. Through the selected points the coronal plane is defined and a red hazy transparent plane is depicted, coronal, passing through the green spheres constantly in augmented reality. With the same manner during the registration phase, certain stable epicutaneous, predefined, pelvic anatomical landmarks obtained through the drapes have to be registered. The points that should be acquired are first commence from the more proximal to the operated side in case the operated hip is the right patient's hip, but in reverse order in case the operated hip is the left patient hip. The Anterior Superior Iliac Spine ASIS P4, and second, the more distal to the operated side in case the operated hip is the right patient's hip. Anterior Superior Iliac Spine, ASIS, P5, reverse selection in case the operated hip is the left patient hip, namely this anatomical point should be registered first. P4, point, by registering both points a green transparent plane transverse plane, passing through the green spheres, perpendicular to previous transparent red plane, coronal, is depicted in augmented reality. By repeating the same procedure and registering at last the symphysis pubis P6, a transparent blue plane appears, saggital plane, passing through the sphere, perpendicular to previously planes. The planes appeared with different hazy transparent colors, sagittal blue, coronal red, transverse green. In augmented reality, app works uneventfully also by placing the patient in lateral decubitus position. In this event only the first step of registration of points over the surgical bed, P1, P2, P3, is changed, namely instead of registering point in coronal plane over surgical bed you select the 3 points over the imaginary, perpendicular to surgical bed plane, points from the back of the patient in sagittal plane by surgical back post behind. See tutorials video at orthopractis.com. B. Acetabular registration. Once the surgeon has finally approached patient's bony acetabulum, acetabular registration is performed by the same manner as previously described, with the pointer tip of the SIPT pressing the point button. 4 anatomical points, namely 3 points at marginal circumference of bony acetabulum rim, 1 in anterior superior lip, A7, 1 in posterior superior lip, A8, and 1 in posterior inferior lip, A9. Avoid selecting for registration the anterior inferior margins of the acetabulum. The 4th point in order to complete the acetabular registration should be at the deepest part of the acetabulum, A10. Each time by pressing the screen during registration green spheres appears at pointer tip in AR. By the registration of the last point, A10, a blue transparent sphere also appears in augmented reality touching the true medial wall, floor, all acetabular surface, and circumference of the real acetabulum. Inside the blue sphere a magenta sphere appear depicting the center of acetabulum, or the center of rotation. By finishing the ASIS pelvic and B acetabular registration over the previous obtained epicutaneous anatomical landmarks, 2 anterior superior iliac spines ASIS and symphysis pubis, a transparent bony pelvis appears in augmented reality in the same position of real pelvis, thus augmenting the reality. The powerful undo feature gives the user the freedom to make corrections without resetting the whole procedure. Simply by clicking the undo button the measurement returns to previous chosen point and thus registering once again the same anatomical landmark, without resetting the whole procedure and avoid starting over again. See screen readings, real-time NT version, inclination angles, pelvic tilt, cup diameter. At the reamer or inserter handle the clamp is attached at 16.5 centimeters away from the tip of the reamer or inserter. The cylindrical tip pointer of the iPhone case probe is inserted and fit into a specially designed cylindrical slot, which is situated over the back surface of the clamp tool and impacted securely. Surgeon can view a gray cylinder between 2 red spheres, rod, image superimposed in the real surgical field through the iPhone display mimicking the reamer or inserter. The direction of the iPhone case with the rod should be turned manually clockwise or counterclockwise and adjusted accordingly so the gray cylinder between 2 red spheres shown in AR should be aligned with the axis of the reamer or inserter direction. Now the surgeon can obtain positional information in real time in augmented reality of the reamer or the inserter. Over the screen in real time 6 pelvic tilt adjusted angles appear. Operative inclination OI, operative NT version, OA, radiographic NT version, RA, and inclination RI, and anatomical inclination AI, NT version, AA. Concurrently also APP angle and D diameter of acetabulum. Pelvic tilt is measured by APP angle, can be either negative indicating posterior pelvic tilt or positive indicating anterior pelvic tilt. Acetabular dimension D is printed in mm, allowing the surgeon to decide in advance the size of starting reamer and the anteroposterior, mediolateral, and craniocaudal positions. Manipulating the reamer or inserter in real time, the surgeon. Values of all above mentioned angles change respectively. Obtaining positional information and direction with accuracy in real time in augmented reality by observing the screen of the iPhone. The surgeon can be directed by app readings and place the cup to optimal and biomechanically sound position according to redefine the safe zone, which take into account patient-specific pelvic tilt. Murphy AB and the safe zone range for cup and T version is narrower than for inclination in the William S. Klein Orthoprelat Res. 2018, 476, 325, 335. The app allows to estimate also the patient-specific pelvic tilt APP angle, feature which is incorporated in measurements, and all values in anteversion and inclination are pelvic tilt adjusted. During surgery, as long as the measured values by the app of operative inclination OI and operative anteversion, OA, are between normal ranges respectively, inclination 43 degrees plus or minus 12 degrees and anteversion 31 degrees plus or minus 8 degrees, the printed color of them in screen remains green. Otherwise, whenever the value falls outside the normal ranges, values of OI and OA are printed in red color. By this, surgeon can be guided easily, seeing screen indications in real time and direct positioning or impacting the cup optimally. Also, according to Lewinek's safe zone, surgeon should place the cup in 40 degrees plus or minus 10 degrees of radiographic inclination RI, and in 15 degrees plus or minus 10 degrees of radiographic anteversion, RA. During surgery, as long as the measured values of RI and RA are between the above-mentioned normal ranges, the printed color of values in screen remains green. Otherwise, whenever they are outside the normal ranges, the values of RI and RA are printed in red color respectively. In quick view, you have to choose sequentially and manually the following certain anatomical landmarks, points, which are shown below with the correct order. ASIS pelvic registration 1 P1, P2, P3 surgical bed, red transparent plain coronal, P1, P2, P3, 2 more distal to the operated side anterior superior iliac spine ASIS P4, 3 more proximal to the operated side anterior superior iliac spine ASIS P5, a green transparent plain transverse plane P4, P5, 4 symphysis pubis P6, a transparent blue plane appears, saggital plane perpendicular to all planes perpendicular to previous transparent red plane, coronal, reality. By repeating the same procedure and registering at last the symphysis pubis P6, B acetabular registration, following points should be collected at circumference of the bony acetabulum rim, A7, anterior superior lip A8, posterior superior lip A9, posterior inferior lip A10, deepest part of the acetabulum. See screen readings, real-time pelvic tilt adjusted anteversion, inclination angles, cup diameter, OI operative inclination normal range 43 degrees plus or minus 12 degrees, green color, OE operative anteversion, normal range 31 degrees plus or minus 8 degrees, green color, rear radiographic inclination normal range 40 degrees plus or minus 10 degrees, green color, RA, radiographic anteversion, normal range 15 degrees plus or minus 10 degrees, green color, AA anatomical inclination AA anatomical anteversion apt angle, expression of pelvic tilt, or plus, D- cup diameter of the acetabulum. All information received from the software output must be clinically reviewed regarding its plausibility before patient treatment. The app indicated for assisting during operation. The operator, judgment and experience are required to properly use the app. The software is not for primary image interpretation. Any influence the operators in making decisions during operation remains surgeon's own responsibility and experience.